There has been a lot of painstaking research into ME-CFS over the years, but one particular strand of research that has been missing has been the pharmacological approach to research. In this video, I'm going to talk about why drug development-based research could not only, of course, help with reducing the symptom burden, or better than that, in ME-CFS, but why it could actually clarify for us much more quickly what the pathophysiology of ME-CFS actually is. In other words, how using the pharmacological approach could actually demystify the illness very quickly and in a way which actually would save us many decades of further research. But first, my name is Patrick Usher, and I'm author of the book Understanding ME-CFS and Strategies for Healing, in which I break down some of the latest, most exciting research into ME-CFS and long COVID, and talk about the various treatment strategies that I have tried in order to improve my own quality of life as an ME-CFS patient. The links for that book are in the description box below. So the ME-CFS research has in general proceeded on the basis of examining different parts of the body, different aspects of it, and trying to find out what's going wrong in those particular areas. For example, there are MRI scans of the brain, examinations of mitochondria. There are examinations of the quantity of blood volume. There are examinations of different things that are going on in the cells, in gut bacteria, autoimmune problems, all kinds of things. And that work has been really important. And without it, nothing is actually possible. But what we can seem left with are a lot of random problems, and it can be hard to deduce what actually is the interrelationship between those problems. So the pharmacological approach instead is to develop a reasonable working hypothesis for what an illness involves. In other words, to have a unifying model of what's actually going on in a disease. And when you have that unifying model, you ask yourself, what therapeutic could treat the model that I have developed? So you find that compound, which is going to work on some aspects of the cycles within the model that you've created. You run a trial based on testing that compound. And this is the really important point. If the compound has the expected results, not only have you found a solution to help patients, but you have also validated the disease model. So this idea can be summarized as the pill proves the principle. Now, what are the implications of that? Well, basically, overnight, the knowledge of a certain illness just takes leaps and bounds forward because you now have a much greater understanding of what's actually going on. So it's the great clarifier. And in this way, it can also then help to guide further treatments and further research because the nature of the illness will be much clearer. So that really is what the ME-CFS world has always needed. It has tended to proceed on the basis of the necessary and crucial step-by-step research, finding a problem here and a problem there. And without all of that, we'd know nothing at all, and so we would be completely in the dark. But what we really need at this point is to test pills based on hypotheses of the illness that can make sense of most of the pre-existing findings, and then see, does that pill actually work, thereby advancing enormously our understanding of ME-CFS just like that. So you basically don't need to know lots about an illness before you test a therapeutic based on it, because the testing of the therapeutic is itself part of the scientific process of trying to understand the nature of the disease. So that's what I think the ME-CFS world needs, because otherwise, I hate to be pessimistic, but my feeling is that even though there's lots of great research coming out all the time, and that will continue, I think that unless something like this happens, honestly, it's just going to go on and on like this for decades and decades and decades, and we're not going to have obvious solutions for actually lowering the enormous burden of human suffering around the world with this illness. So at some point, we got to switch to actually testing therapeutics based on models of the illness in order not just to reduce suffering, but actually to really more dramatically move things along. Now, I'm saying all of this, by the way, as someone who is not a pill popper. I am someone who has taken very few medications in my life. I will take them if I have to. I would consider taking medications if there is a rationale, particularly if I could take them for a period and then taper off later. But it is obvious to me, even as someone who prefers other approaches to healing, that this is absolutely urgently what the ME-CFS world needs. Not just for the reasons I've already mentioned, but also because if you have a pill, an approved medication, which is then promulgated by a major pharmaceutical company all around the world in conjunction with government health systems, etc., would overnight remove the stigma of ME-CFS, would remove the psychologization. Because if there is one thing doctors love, it's pills. And they love putting people on pills, and they love their patients coming back and saying, hey doc, I'm feeling a lot better. So they like that, right? And so if the doctor says, there's an ME-CFS approved medication, it targets, for example, if we think of Myalgic, which is the pill that I really want to see get developed from the work of Professor Wirth, which targets the muscle cell abnormalities in the illness, and check out my previous videos on that. If they say, here's a pill for that, here's a pill for ME-CFS, then it becomes impossible to simultaneously maintain a psychosomatic view of the illness. And so overnight, it all changes. There'll be more research funding, there'll be more teaching of the disease. It ends all the bullshit, basically. These are some thoughts that I have on why this has to happen. I hope it happens sooner rather than later. Myalgic is still looking for its investors. But this would represent a major leap forward on several fronts for the ME-CFS world. That's it for this video. I look forward to your thoughts on it, and I'll see you in the next one.